Why do newborn babies cry loudly? 1. Physiological reasons. Establishing breathing. When a baby is in the mother's womb, it obtains oxygen and nutrients from the mother through the placenta and umbilical cord, and the lungs are in a compressed state. After birth, changes in the external environment stimulate the baby, and crying loudly is an important way for the baby to establish autonomous breathing. When the baby cries, the lungs expand and air enters the alveoli, thus starting the normal breathing function. This is like a bellows that was originally closed tightly, and crying is like pulling the handle of the bellows to allow air to enter smoothly. Removing foreign bodies. During the birth process, a baby may inhale foreign bodies such as amniotic fluid. Crying loudly can help the baby clear the respiratory tract and expel these foreign bodies from the body. It's like when a small pipe is blocked. The blockage is flushed out by a strong air current, the air current generated by crying. 2. Adapting to environmental changes. Temperature changes. The temperature inside the womb is relatively constant, while the temperature of the external environment is usually lower. After leaving the warm and comfortable womb, the baby will feel cold. Crying is a reaction of the baby to this temperature change, and also a signal to convey its discomfort to the outside world, just like we shiver unconsciously when suddenly entering a cold environment. Stimulation from light and sound. The environment inside the womb is relatively dark and quiet. After birth, the baby will be stimulated by the intense light and noisy sounds of the outside world. This sudden change will make the baby feel uneasy, and crying loudly is the way they express this uneasy emotion, similar to how we feel nervous and anxious in a strange and noisy environment. 3. Psychological needs. Expressing needs. Babies are unable to express their needs with words, and crying is their only way of communication. When they are hungry, thirsty, have a wet diaper, or feel any discomfort in their body, they will cry loudly to attract the attention of their parents or caregivers. This is an instinct of the baby. Just like the young of animals, let their mothers know their situation by making sounds. What can parents do to soothe their babies when they cry loudly? When babies cry loudly, parents can try the following methods to soothe them. Meeting basic physiological needs. Checking for hunger or thirst. For newborns, breastfeeding is one of the most common ways to soothe. If it is breastfeeding, the mother can hold the baby in her arms, let the baby get close to the breast, help it latch onto the nipple, and start sucking. Generally, newborns may need to be fed every 2 to 3 hours. If it is formula feeding, the formula can be accurately prepared according to the instructions on the formula milk package, and then fed to the baby with a bottle. At the same time, attention should be paid to the feeding posture to ensure that the baby can swallow comfortably and avoid choking. Besides feeding, the baby may also be thirsty. After the baby is a little older, usually around 6 months, a little warm water can be appropriately given to the baby to quench its thirst. Checking the diaper situation. Parents should promptly check whether the baby's diaper is wet or dirty. If so, a clean diaper should be changed as soon as possible. When changing the diaper, the actions should be gentle and quick to avoid the baby getting cold. First, remove the dirty diaper. Gently wipe the baby's buttocks with warm water and a soft towel or baby wipes, then apply diaper rash cream, and finally put on a new diaper. Providing comfortable physical contact. Gentle hugs and strokes. Gently pick up the baby and let the baby's head rest on the parent's shoulder or chest, and gently stroke the baby's back with the hand. This intimate physical contact can bring a sense of security to the baby, just like they were tightly wrapped in the womb. The stroking actions should be gentle and rhythmic, either stroking up and down, or in circular motions. One can also try gently massaging the baby's limbs. Start from the baby's shoulders. Gently massage along the arms to the fingers, and then start from the thighs and massage to the toes. Massage can promote the baby's blood circulation, and at the same time make the baby feel comfortable. Using a soothing blanket or pacifier. A soothing blanket is a soft small towel. Parents can place the soothing blanket beside them for a while to let it pick up their scent, and then give it to the baby. The baby can get comfort by touching and grasping the soothing blanket. A pacifier can also soothe the baby to a certain extent. However, attention should be paid to choosing a pacifier suitable for the baby's age and ensuring its cleanliness. When using the pacifier, observe the baby's reaction. If the baby resists, do not force its use. Creating a quiet and comfortable environment. Adjusting light and sound. Babies are sensitive to light and sound. Parents can dim the lights in the room to create a relatively soft environment. If the surrounding environment is noisy, curtains, soundproof earplugs for the parents themselves, or white noise machines can be used to reduce noise interference. White noise is a uniformly distributed sound, such as the sound of ocean waves, rain, or a hairdryer, etc. These low-frequency sounds can simulate the environment inside the womb and make the baby feel more comfortable. Gently rocking. Parents can hold the baby and gently rock it, but pay attention to the amplitude and frequency. One can rock slowly with a small amplitude from side to side or back and forth, just like the baby is in a cradle. This rocking motion can make the baby feel relaxed, but make sure the baby's head is well supported to avoid excessive rocking causing harm to the baby.